tag my comment. This evening we are talking about the liver, and I don't know, I think it's pretty cool, the liver, and it's not something you expect to discuss with your gynae, but absolutely it's something that as you find out more about it, you realize that without understanding your liver health, it could be some real problems. Hi, Sujan. Hope you had a good day, and welcome, and thanks for joining in, everyone. And tonight we're going to talk about liver health. One of these days I'm going to figure out how to pin my comment. Yeah, here we go. All right, so welcome everyone, and yeah, we're going to talk about the liver tonight. I'm going to keep it brief because the study of the liver actually is what's called hepatology, and I did not do that. And that's like 5 years extra on top of basic medical training, because that's how complicated your liver is. And the quick post that I would have put up today talked about the liver's ability to regenerate, and it's a pretty cool organ. And now more and more studies are coming out about women and their liver health, and birth control pills. Most of our estrogen runs through there, so risk of even, I'll talk about it all in sequence, but there's risk of tumors and growths in the liver when you're on the pill, when you're pregnant, and now they're actually acknowledging PCOS as a risk factor for the liver. And the subtlety of the symptoms is what's a bit concerning, because now do we all have to check our livers, guys? Come on, enough already, right? So again, welcome in, and we're going to talk about the liver tonight. And the post that I did tonight was of a Greek mythology character named Prometheus, and I have some slides. And so Prometheus, the way the story goes, so basically he's punished by Zeus, and Zeus punished him because he stole fire to give it back to mankind. That's all I got. That's the story there. But the punishment was quite twisted. So Zeus asked them to chain him to this rock, and this is in the Caucasus Mountains, and every day an eagle is going to come and just peck at his liver and eat part of his liver, and each night the damn liver is going to regrow and regenerate, which meant he just continued to endure this punishment for all of eternity. But it's something that I hang on to, understanding the importance of our liver. And that story rings true because, yeah, you can, it's a pretty resilient organ, and we tend to abuse it in simple day-to-day ways. The way that we eat, the alcohol intake, the medications are on, affect our liver, and it still somehow sticks with us. But chronic liver disease and failure, as I'm going to talk about, happens quite slowly and subtly, and it's important to sort of take note of this as well too, right? The many roles of the liver is important. So it's a powerhouse. Just think of a big factory where there's a lot of soft sorting and shifting happening. So everything that goes into your system, or anything you're exposed to, really is sort of run through the liver. So it has over 500 functions to sustain you. It is the largest. Oh no, I'm wrong. I said that, and I fact checked myself, and it's not the largest organ. It's the second largest organ. I meant to ask anyone in here if you know what the largest organ in our body is. The liver is the second largest, however. So I posted that earlier, and that was a bit incorrect. It's the largest. No, I'm going to leave it. If you have the answer, you can volunteer. What is the largest organ? Hi, mommy. Good night. I see you're locked on. What is the largest organ in the body? So the liver is around the 3-pound organ. Very good, Sujan. The skin, yes. I wonder where you've heard that before. I do speak about the skin as the largest organ regularly, because the skin is really just like the liver. Everything we put in, it's going to find its way out, and the skin is a huge, important vehicle to get stuff that we put in out of our system. So the skin is technically the largest. The liver is the largest internal. Avi and Hadassah, y'all are right, running up with number 3 and 4. And you're right, stomach is larger, lungs. The intestines are pretty long, and they cover a lot of square footage. But it's the skin is the largest, and the liver is the second largest internal organ. And it's a solid organ as well too. Weighs on average about 3 pounds, and it's tucked away. And I have another slide here. I try to stick to inanimate things so we don't get too gross, right? But it's tucked away under our ribcage on the right upper side. So even in training, even ingrained in me now, if a woman who's pregnant specifically shows up with a specific right upper quadrant pain, we call it, or a woman in her 40s ate some great cheesy oily pizza and she has this right upper pain, that's really a quick and dirty way to know that it's a liver or gallbladder issue because of the location and the type of pain that it is. More centrally located would be the stomach, and then following for that would be the intestines, which Abby mentioned before, and then connecting to from the right going across to the left is our colon. But we're focusing on the liver. The lungs, which Hadassah mentioned as an option for what were the largest organs in the body, we have 2 of them. They are right above the diaphragm, the liver is right below it, and the heart is in the middle. So here's this largest organ, weighs about 3 pounds. Everything you put in your body has to pass through your liver. And then if there's issues with the liver, everything you see, and even the things you don't see, the heart, the pancreas, and so forth, everything's affected. They have estimated that if something really goes wrong with your liver, you're going to live about a day, really. Maybe 2, but you get really sick sometimes really fast if anything attacks our liver, right? Let me come back out of that. And again, everyone who's joining in, thank you for coming in. So then the nitty-gritty of the liver, I said I'm avoiding. I'm going to keep this simple because I didn't study as much as a hepatologist would have in school. I had to learn about the liver because in pregnancy, women get preeclampsia and the liver gets congested. All of these blood vessels in the liver, they just react to, we still don't know exactly why, but they react to changes within the pregnancy to do with the placenta and the baby and antibodies and all these things. And the liver becomes congested. And a pregnant woman, again, right upper quadrant pain coming in. It's not contraction pain. She's in her 3rd trimester. Her ankles are swollen fat. She's puffy. She's just, in the last week, gained about 10 pounds in the end of her pregnancy. That's preeclampsia, and the liver is acutely tied into that as well, too. One of the main things we would do when you come in with this situation in your pregnancy is assess your liver function. And that's a key indicator that, hey, this pregnancy should be delivered. The liver is shutting down quite rapidly and things can go south really quickly as well. What I'm showing here is, again, an inanimate view of the structure of our liver and the way that the liver just absorbs and filtrates and detoxifies and sorts what's good and makes what we need and tosses what we don't need, ties into the way that these blood vessels run. And the interior veins and arteries and those bigger ones, they connect really just right up to the diaphragm to our heart, right? So, I'll talk about liver failure soon and heavy alcohol use, and the heart fails in alcoholism because the liver is failing as well too, right? So again, I'm staying away from the gory pics. These are more inanimate, but definitely I think it's just a good way to kind of simply digest what the liver represents for us. All right, so the liver does the following. It filters toxins from our blood, right? It produces enzymes that break down the things that we eat, everything that goes, everything, me or the liver, he said pretty, but everything that goes in, it detoxifies, and then enzymes are produced to break down our foods. So the foods are broken down when we chew, and saliva breaks down food, but the stomach does some work, and then the liver really just starts extracting what we need and what we don't need, as I said. So I'll put back the pretty picture since I think that's what you're referring to. But what I'm describing here with the function. So within this 3-pound organ tucked under your rib cage, there's filtration, there is purification, things are digested, bile acids and bile salts. I kind of left off the gallbladder because, again, this is easily potentially could be a med school lecture, which we're not going to do tonight. But just visualizing this factory, this organ doing all of these wonderful things for us, we have to treat it better most times, and that's what I'm going to talk about tonight. Within there's also storage. So it stores our vitamins and minerals. I speak about vitamins all the time, minerals all the time. So the liver is not only filtering and detoxifying, it's breaking down using enzymes, and it's storing stuff. And then it's also regulating our hormones and our immune system as well, and how our blood forms clots. Oh my gosh, that was a mouthful. That's 5 bullet points in my notes, but it's really just running throughout the course of the day. So if this shuts down, again, studies say you got a day to live. You got to like call your enemies and make good with them, because without your liver, we really would have some problems. In terms of helping blood clot, this is so important. After all of us were born, I would assume, most of us, depending on where we were born, most of your children, depending on where they were born, would have received a quick stick on the heel or the bumsy. The baby gets a quick injection of vitamin K, because the liver stores and houses vitamin K, but we don't start making it until after we're born. So they give that injection to your child, or to us. I think we all got it. It's been accepted as a practice for well, over a century of childbirth probably. But giving that vitamin K indicates that our liver is a main production source for vitamin K to allow our blood to clot. So when you give birth or when a child is born, a lot of trauma sometimes happen, and without that little injection, and sometimes in rare cases, parents may refuse that vitamin K because, again, mistrust, what is this for? Don't give it to my child. It's very rare, but that child can have hemorrhage or bleeds on the brain because coming through the birth canal, there was some trauma. And without that vitamin K being made in the liver, we'll be in some problems. So vitamin K is important for blood clotting. It is made in our liver. So as we're knocking back our beers and stuff, and we're really harming how our liver works, these are some of the things that would manifest when the liver starts to fail, right? Avenue says vitamin K. Yes, we need it, absolutely. So your liver is, again, the only organ in our body that can regenerate or regrow, right? If I lose my finger, that's it. They got to reattach it. I'm not going to grow another finger, right? Please, I don't want to lose my finger. Why did I use that example? But, we don't regrow things normally. The tongue has some regenerative qualities. You bite your tongue and it heals fairly quickly. But the liver in itself is the only organ in the body that can regrow after parts of it have been removed or even damaged. Again, it's resilient, it is forgiving. We do a lot of things that are harmful to our liver, and our liver just keeps chucking along and supporting our health. In fact, it can grow back to its full 3-pound size in just a matter of months if we treat the liver right in the right situation, if you have a liver issue, right? But can you live without one? Absolutely not. The liver is so crucial, as I'm saying over and over, that you can live with a part of it, but if you have no liver function, then your blood won't blood clot properly. I just spoke about vitamin K being produced there, and the reason why all of us, if not most of us, would have gotten that vitamin K shot immediately after birth. Uncontrolled bleeding. Some people with vitamin K deficiencies, which is a genetic issue, they really need to be treated appropriately before any kind of scheduled surgery or emergencies. If you don't have your liver, then toxins and chemicals will build up fairly rapidly. Byproducts of things that we've eaten would build up again too in the blood, and you become pretty sick. You'll have fewer functions in your immune system, infections, again, swelling, retaining fluid, swelling in the brain. So within the liver, all of these things are sort of shut down without the liver. So acute liver failure, I'm going to touch on that real quick. Acute liver failure, which is called fulminant hepatic failure. Nobody needs to ingest this. We're not going to be quizzing you guys anymore. But it leads to a very rapid deterioration of the liver. Now, this is often where I have a perfectly or relatively healthy liver. And it's exceedingly rare for this to happen, by the way. Most liver issues are chronic, and we sort of miss little subtle hints that we're having a problem with our liver. But with acute liver failure, it happens really fast, and it happens within days, maybe up to weeks. but it happens suddenly without preceding symptoms. So I just explained all these things the liver does. And in acute failure, it does happen that rapidly because if the factory's closed, the factory's closed. So common causes, really mushroom poisoning from ingesting mushrooms. So if you have friends that partake in mushrooms, safety is key. That's a whole other show. But mushroom poisoning, drug overdose of any kind, really, again, everything goes through your liver. So illicit drugs, liver failure is one of the ways that someone who's a drug user will sort of have medical complications that may lead to demise. And this one is big because it's the most common, and it's from taking too much Tylenol, acute liver failure. So a lot of times I am told, I don't want painkillers, I don't want to get hooked on anything if someone has had surgery and they prefer to stick to Tylenol, which is relatively harmless, but in large amounts. That's why it's important to understand you should not ingest more than 2 grams of Tylenol really in a day. Plus, if you've gone over 2 grams, the reason you're taking it is not effective for that pain, and that pain needs to be evaluated, right? So one usual Panadol or Panadol extra strength, which is also Tylenol, the main ingredient is acetaminophen, is usually 500 milligram tab. Always read your tabs and read the instruction. They'll say take 2, and you can take 2 every 8 hours or so. You can take 2 every 12 hours. But once you start hitting 2 grams, 3 grams of Tylenol, the reason why, unfortunately, it is a drug of choice when people are suicidal is because, again, a very rapid shutdown of the liver. That's how it works. And Tylenol overdose is immediate medical care. It's salvageable. We can recover from it if immediate medical care is provided. But taking too much Tylenol. So you have to be careful when you're using your Panadol for period cramps. You have to be careful when you're using it if you have a dental issue. If it's not covering your pain, you can't just keep taking acetaminophen because it is one of the most commonly seen reasons for acute liver failure. But luckily, acute liver failure is still pretty rare. Right, so show of hands if you guys knew that one already. In the busy session and 30 minutes, 40 minutes seeing someone, I don't get time to speak about these things often, but it's important to know. Read your label, and Tylenol, too much of it. Tylenol, which is acetaminophen, which is the same as Panadol as well, too. Right? Now, whichever medicine you're on or whatever medicine you take, it will pass through your liver. Again, factory, right? So if the liver is impacted in a negative way and it's starting to be an issue with liver failure, acute liver failure, again, fulminant hepatitis, it happens quickly, days, weeks, and you're hospitalized and the liver is shutting down. Symptoms of liver failure, whether it's acute or chronic, are again very subtle, but there's one that we really should know about, which is jaundice, right? Jaundice is the yellowing of the skin and the whites of the eyes. Babies and newborns really get another version of jaundice, which we're not going to address today. But jaundice, so yellowing of the whites of the eyes, is one of the symptoms. And again, I spoke about the location of the liver, tucked up under the rib cage on the right side. It's large, it's spanning across the upper right area. So abdominal pain, bloating or swelling in that area, nausea as a symptom as well too. And again, because of everything our liver is doing, you get disoriented, mental disorientation as a symptom as well. So Sujan has a question. Let me just, hold on, I was going to show jaundice. That's jaundice. That's jaundice. I couldn't find, anyway, that's jaundice. But Sujan's question is, wouldn't most painkillers, if you take too much, affect the liver? Everything affects the liver, absolutely. Everything. Thank you for the show of hands, guys. Yes. Some of you work in the healthcare industry. I see the names that are here, but yes. And Sujan, yes, everything goes through the liver, absolutely. But Tylenol in itself, as in excess, is a direct reason for acute liver failure. You can damage your liver in 1,080 ways, but this one is when your liver shuts down on you. And again, the marker for acute liver failure is my liver was healthy last week, and I did a bunch of Tylenol and it shut down on me, right? So symptoms-wise, I hope I answered your question there. Symptoms-wise, jaundice is the yellowing of the skin and the whites of the eyes. I was looking for people of different complexions. I ran out of time today, but this is one symptom: abdominal pain and swelling, as I said, mental disorientation and nausea, chronic liver failure, again with the same symptoms, but it then also has change in the color of your stools, which I'm going to talk about as well too. Clay colored stools, your stools are becoming lighter and lighter and so forth. Those are signs of liver failure, right? So Avian is connecting so she's asking, that's why babies born with jaundice because of the lack of vitamin K. Actually, no. So newborns are complicated, my girl. The jaundice has to do with bleeding, yes. The jaundice has to do with mummy's blood. The jaundice has to do with, it's a whole other session. The vitamin K, however, has to do with the baby being able to form a clot. So if a child is being born, and the bones in the head have to be molded and come through the birth passage, or even at the time of a C-section, right? Childbirth is not usually gentle in any way. So we need to be able to form clots. Without that vitamin K shot right after birth, there is, not everyone, but there is a percent of us that's going to have a brain bleed because we had some trauma during birth or an injury of some kind, and the vitamin K is important for clotting. Right, so I really like that question. You guys can keep them coming. So this was the example of the symptoms. What I also wanted to make sure, and this you can give a show of hands if you knew this already, but herbal remedies like green tea extract, right? All our green tea lovers in there. I usually ding caffeine, and I always feel hypocritical dinging caffeine, but green tea specifically, and aloe vera. It's a few more, but those are the top two. You have to use those with caution if you're ingesting those as well, because they can in excess. Remember, everything's in excess is the issue. Finding balance and doing things from time to time, there's usually no problem with that. But in excess most times. Aloe vera extract ingested and green tea extract, very concentrated, can have some serious liver damage because, again, everything we put in has to go through. And just be careful. Painkillers, just to touch on that one more time to make sure that point is accepted and driven home. They are a threat as a major cause of acute liver injury. They're considered a drug-induced injury to the liver. Paracetamol, which is also known as acetaminophen, has become one of the leading causes of acute liver failure. And we all have it in the house, and we all use it, and we feel safe using it for so many reasons, but again, in excess. And, you can go up to 4 grams, which I said 2, really. Once you start crossing over 2 grams, you're hitting 4 or 5 doses in a day. Whatever pain you're trying to treat isn't getting better, and you need to back off the Tylenol as well too, right? So Joseph Moline happens to be my mom, is asking, do liver transplants work? Absolutely. So they are still in the forefront in terms of transplants that make sense. And the liver is so, again, resilient and regenerative that you can be in liver failure and dying within a day or two and get a transplant, and within a week or two, like the soap operas that you like to watch, mommy, you're back up and at it, because the recovery and regeneration of the liver is pretty remarkable. So yes, liver transplants do work, and you can do a partial liver transplant for a relative. You can keep your liver. Your liver usually, as I said before, would regenerate back to its enormous 3-pound size, right? So again, the questions are coming in really nice. So here's the next doozy. So that was the green tea extract and stuff, and then the Panadol, birth control pills. And someone asked me, how do you choose the topics that you do? And I choose these topics just based on how my day goes. And yes, there are women who are on the pill or postpartum or during pregnancy who will have liver issues. But the birth control pill does have a direct impact on your liver. Now, in terms of the impact on the liver with the birth control pill, it's really been accepted that when it's an extended period of time of use. 5 years or more on the pill, you usually can continue it safely if you don't have any other major issues and your blood pressure's fine and your weight's been stable and so forth. But with regards to the liver, it's important to just look out for signs. And this is not anything to really just become obsessed about with your liver. I think the average person in their 20s to 30s should get a regular checkup every 2 to 3 years. In your 40s, don't let 2 years without getting a regular checkup. In your 50s, yearly, and so forth, because at some point, even the more vague symptoms will be caught and you can catch a liver issue. With regards to the pill, the estrogen, right, in the oral contraceptive pill is associated with liver-related complications. So we talked about liver failure. This is not acute failure, but the pill can cause different changes within the liver, blocked areas where things get backed up. Maybe I can show that pic of the liver again that Avi thought was so pretty, this one. So while on the pill, right, areas of these blood vessels, some of them can get more dilated than they should, because remember, estrogen works on our circulation, and this is a lot of circulation packed into one organ. So areas can become more dilated, blood flow can be affected. Small benign tumors called hepatic adenomas can start growing in the liver, and funny enough, you may find out you have this when you go for a CAT scan for something that's seemingly unrelated, and then you get told go see your gynae, and then I have to tell you, oop, you have to come off your pill, you have an adenoma. It's more than likely benign, but we don't like anything that grows. So there's chunks of the liver that start getting more solid, and there is the risk theoretically of liver cancer. No real documented cases or fatalities have been noted from the pill from that, but it still remains on the list, because if something's growing, we have to, see what's going on with there. And then, funny enough, talking about circulation, the central main veins in the liver can also form blood clots, just like your legs might, or your lungs might as well too. Right? So I'm kind of trying to package this in because, again, the study of the liver, real complicated. I didn't do it. So just trying to keep you guys clued into the things that can impact you from day to day. With regards to the pill, the tumors that form if you're on the pill for an extended time, I said, they are normally benign, but again, there's very rare occasions where they might develop a cancer. So liver injury while on the pill in itself is actually rare. You don't have to stop your pill tonight. You don't have to keep worrying about this as an issue. But as I said, following through on any medication that you're on, following through the routine checkups would be an opportunity to pick up on something, right? If anyone has any more questions, just keep putting them in here as well too. Now, if I'm on the pill, but I'm drinking heavily, I am drinking, 4 drinks a day or something, which I don't know how that would even happen, but it happens. So that's called alcohol misuse. Then I'm setting myself up more so for a liver issue, right? The chronic liver failure, which I talked about acute, chronic liver failure occurs over time. And it occurs because of inflammation in the liver, things we're doing on a daily basis. All of these little blood vessels, which are just trying to do their job. The 5 things I listed: detoxify the blood, build our enzymes, break down foods, store stuff, right? The function of the liver, the things we do. So alcohol misuse is one of those. Anyone who's been diagnosed with a liver issue, they literally tell you females 1 drink max, males 2 drinks because of the liver, what the liver can tolerate. But in general, just be smart about alcohol. So alcohol misuse, and this will occur over months up to years. Again, I spoke about people who actually have heart failure from alcohol addiction and alcohol abuse. Infections. Hep B, A, B, C, D, E. I'm saying the alphabet. That's another reason for chronic liver failure. Those of you who work in the healthcare field, university students, you get your Hep B vaccinations. Because these viruses will shut your liver down as well too, very chronically. And then you start getting the jaundice, which I gave an example of as well too. There are a few rare genetic disorders, and then the main one I'm going to talk about with regards to polycystic ovaries, diabetes, obesity is what's called non-alcoholic fatty liver disease, where these pockets of areas in the liver just starts getting plugged in with globs of fat. Like seriously, it starts collecting globs of fat, and it's just a factory that's supposed to do all of this stuff. So now we're running out of real estate in the factory to really do what's needed, right? So chronic liver failure, again, it develops over months, over even years before you even start showing any symptoms. Okay, so I wanted to show a slide. If you guys don't have any questions, I'm gonna wrap up soon, but plowing through. So this is the liver as explained, and again I kept sticking to inanimate looking pictures. I don't gross anyone out. Healthy liver up to the top. As the liver is going through fatty changes or damaging it with our our heavy alcohol use, the liver becomes fibrotic. Cirrhosis is the next stage, and you're pretty sick at this point. You have those jaundiced eyes that I just showed, and then liver cancer, which is still pretty rare, but again, this is a transition that the liver would go through that you would need to know about, right? So I'm going to stop sharing for a second. Does anyone have any questions? Everyone's with me so far? Okay, now in terms of the liver, again, a healthy liver is sort of spongy and it's just soaked up with blood and is doing everything it needs to do. As you get more inflammation in the liver, the healthy tissue gets inflamed and then it heals and it scars. So it's a series of scars forming, and that really takes away the function, and you have typically less function in the liver. With the fatty liver disease, it's natural for the liver to have a small amount of fat. However, with non-alcoholic fatty liver disease, your amount of fat in the liver is quite significant, and that leads to dysfunction. And again, it's chronic. So you might be living your life in your 30s and happy hour every Friday, and then dealing with some sort of liver disease in your 50s and 60s, ladies, right? Okay, so the known conditions that set us up or put us at risk for fatty liver disease is obesity, right? Just fat in your bloodstream, going through the liver. Everything goes through the liver. It just gets stored there in chunks. Obesity, type 2 diabetes as well, and then genetics, right? Our ancestors, those people that created us and that we're related to, we're going to inherit some risk. So that's why it's important to keep looking at your family. Look at the people in front of you, the people behind you, and keep making connections in terms of your health as well too. So symptoms of liver failure, I'm going to go back here, and I see the show of hands. Thanks everyone. Going back here, this made me jump back, so I don't know about you guys, I apologize, but this is jaundice, and we have all seen this, right? But other symptoms of your liver just saying, I'm done with you when your happy hours, is chronic nausea, a loss of appetite. And I said already, liver failure actually takes years to pick up, because everything I'm listing here is, right, pretty vague. So nausea, loss of appetite, fatigue, diarrhea, jaundice, which is the yellow color where the whites of the eyes become replaced, sudden weight loss that you weren't working for, so unexpected weight loss, easy bruising. I talked about the vitamin K and the role of the liver and blood clotting. So even if I'm doing a pap and I see a weird bruise, I'm like, do you bruise easily and so forth? Because if we're bruising easily, it's fairly simple to order a panel and check on your liver and make sure that's not the source. Itching. Who knew? Show of hands, itching was a sign that your liver is probably done with you, right? Or you're on a birth control pill and you just itch a lot. You have an itching. There's no rash. You can't explain the itching. There's no trigger that you can sense, but there's a total body itch that happens. And that has to do with the liver losing some of its function. So those bile salts that build up because of places in the liver that are scarred or fatty that aren't working, they collect under your skin, and you feel like ants are walking on you, and there's no rash, you're just itching. If you're on a pill, if you come back for a visit and you're on the pill, that's one of the things I would ask about: skin changes, itching, and so forth. During a pregnancy, at least maybe 10% of women while pregnant would have that crazy itching, like it's incessant, and it's treatable, but it has to do, that itching that drives you crazy has to do with, yes, that's funny, you're actually itchy right now. I want to itch myself too, but that itching, that there's no rash, and you feel this creepy crawl everywhere, that's a sign that your liver is not happy with all of those happy hours, with all of those brunches, boozy brunch and all this stuff where you're having alcohol misuse, or it's your birth control pill, or it's your pregnancy, or some of the hormonal change. And now they're adding PCOS to the list, right? Like we needed more on the list for PCOS, but absolutely. Easy bruising, itching, fat ankles all of a sudden, right? So your fluid buildup in your lower extremities, your ankles, your toes are stiff with fluid. The general puffiness, again, could be the liver. And by the time it's a problem, you really have like fluid buildup in the tummy area and so forth, right? So I'm sorry if I made you guys itchy there with that one. Now, those symptoms can be caused by a bunch of other things, even the jaundice. So this was what makes the liver issue hard to diagnose, and some people won't show symptoms for years. Some people find out by accident. Some people find out just before they're told, hey, this is the last fatal stage for your situation. Some with liver failure may just feel they're at work and they feel disoriented, drowsy, collapse, and they're in a coma. And then you find out that, oh, his liver failed. So we have to show some respect to this organ, right? Avian has a statement, half of those symptoms will be masked by other things, nausea, fatigue, exactly. Even the diarrhea, the bruising, right? Okay, so fatty liver disease, you're at higher risk. I'm going to take this guy away because he made me jump back. So you're at higher risk of fatty liver disease if you are overweight or if you have a diet that's high in fat, because I'm not going to let the skinny minis off the hook, right? A lot of times you have someone who's 98 pounds. I say this all this time. I have a name for this person. Her name is Sophie. She's skinny on the outside, but she's a fat girl on the inside. So she's eating pizza. She doesn't gain weight for whatever other reason, but she has a fatty liver. So it's not just obesity, but you know, the textbook is going to say obesity, but I do know there's a lot of Sophies walking around as well too, right? Especially here. So if you have liver damage and you drink alcohol, removing alcohol is also important. Someone in full alcohol failure with an alcohol addiction or alcohol abuse problem really would need to be, the medical doctors have to sit on them, because it may take just a drink or two to slip them back into a really poor state with their liver as well too. And everything in moderation. Think about the fact that I said everything you put in your body has to pass through your liver, right? The skin does a lot of other processing and release of toxins, right? That's why I don't shy away from sweating. We're supposed to sweat. The liver is doing a lot. And at the end of the day, if you are more discerning about what you're putting into your body, then your liver's going to love you more, and you have a better love relationship with your liver as well too. Things like obesity, diabetes, high blood pressure, high cholesterol may not be in the forefront of your mind as you're in your 20s, 30s, even in your 40s. But again, this accumulates over time as an issue. You guys would expect me to say this, and I'm going to say it like a broken record. Lose weight, exercise regularly, make dietary changes, make it make sense, right? Because the first line of treatment if you have fatty liver is weight loss. Because imagine if doing those mountain climbers or burpees, which doing those things are also, in addition to burning fat, right, and defining your muscles here in the liver, we're going to lose that fatty liver as well too. And again, people at risk on the pill, overweight, heavy alcohol misuse as well too, right? Does anyone have any comments or questions on this at this point? This was I think most of the information you guys would know, but this was I think important, simply more so because the fact that the symptoms are so vague, the hormonal impact, the being on the pill and so forth will continue on for years without you knowing this issue. Right? Hi, Johnny. Welcome on in. So again, thanks guys for giving me your time. I kept it simple. There's an entire specialty called hepatology where doctors study the liver for years and years. Quite a wonderful organ. I'm obviously quite a bit of a nerd about this, but I want you guys to know what I know. I realize that, and I think it's important to know that everything you put into your body goes through your liver. I'm not saying don't drink. People advertise all of these different detoxes and stuff for the liver, but it really starts with what went in the first place, and the liver will do the rest because, it's a pretty cool organ, right? So thanks again, everyone, for your time. I'm going to wrap up. I'm going to post this. You can watch it. I'll probably watch it again in the morning when I'm having my coffee. You can share this. PCOS is so far-reaching that a lot of these conditions affect your male members, your non-menstruating members of the family and so forth. So it's important to kind of start knowing what's going on with our bodies, right? So thank you, everyone. And I wish everyone have a blessed rest of the week. Okay, and good night.